G'day folks, I'm Dr. Zoe Mitchell, and I've been working as a urologist here in Sydney for over 20 years. Today I need to talk to you blokes about something that most men over 60 won't discuss with their mates down at the pub, but it's absolutely critical for your health. If you're not masturbating regularly in your later years, you're putting yourself at serious risk for a whole range of health problems. I know, it's not exactly dinner table conversation, but stick with me, because what I'm about to share could genuinely change your life. Right, let me start with something that'll probably surprise you. Last month, I had a patient come into my clinic, 72 years old, fit as a fiddle, plays golf twice a week, looks after his grandkids. But he'd been having trouble sleeping, his memory was getting dodgy, and he was feeling anxious all the time. After we ran through all the standard tests and everything came back normal, I asked him about his sexual health. Turns out, he hadn't had any sexual activity, including self-pleasure, in over 3 years. His wife had passed away, and he just thought that part of his life was done and dusted. Here's the thing, and this is backed by heaps of research. Regular sexual activity, whether it's with a partner or by yourself, plays a massive role in maintaining your brain function as you age. I'm not making this up. When you experience sexual pleasure and orgasm, your brain releases a cocktail of hormones, dopamine, oxytocin, and endorphins. These chemicals don't just make you feel good in the moment, they actually protect your cognitive function, improve your memory, and help prevent mental decline. Think about it like this. Your brain is like any other muscle in your body. If you don't use it, you lose it. Sexual activity keeps those neural pathways firing, keeps the blood flowing to your brain, and maintains healthy hormone levels. Testosterone, which is intimately linked to memory, decision-making, and vitality, can decline much faster when sexual activity drops to nearly zero. And testosterone doesn't just affect your libido, it affects your self-esteem, your strength, and your mental clarity. Now, I reckon some of you are thinking, but Doc, I'm 75. Surely that's just part of getting old. Not necessarily, mate. Yes, things change as we age, but completely abandoning sexual activity can accelerate that decline. Studies have shown that men who maintain regular sexual activity, even through self-stimulation, have better cognitive function, lower rates of depression, and even reduced risk of dementia compared to those who don't. Let me talk about your prostate for a minute, because this is bloody important. Your prostate is about the size of a walnut, sits just below your bladder, and it's responsible for producing some of the fluid in your semen. As you get older, it's common for the prostate to enlarge, which can lead to benign prostatic hyperplasia, or BPH. This causes problems with urination, frequent trips to the loo at night, weak stream, all that frustrating stuff. Here's what most blokes don't know. Regular ejaculation can actually help keep your prostate healthy. When you ejaculate, you're clearing out the prostate, flushing out potentially harmful substances, and keeping the glandular tissue active. It's like cleaning out your gutters. If you don't do it regularly, things build up and cause problems. Research from Harvard University followed over 30,000 men for nearly 2 decades and found that those who ejaculated at least 21 times per month had a significantly lower risk of prostate cancer compared to those who ejaculated less frequently. Now, I can hear some of you asking, how often should I be doing this, Doc? Right, let me give you some straight answers, because I get this question heaps in my clinic. For men over 60, I generally recommend 2 to 3 times per week as a good baseline. That's frequent enough to get the health benefits without overdoing it. Some of you might be comfortable with more, some with less, and that's fine. The key is consistency and listening to your body. Is it better than having sex with a partner? Look, both have their benefits. Sex with a partner gives you the added benefits of emotional connection, physical touch, and intimacy, which are fantastic for your mental health. But self-stimulation has its own advantages. It's always available. There's no pressure to perform. You can take your time, and it's entirely on your terms. For blokes who are single, widowed, or whose partners have health issues, self-pleasure is an excellent way to maintain your sexual health. Let me address something else I hear constantly from patients. But Dr. Mitchell, I was taught this was wrong, that it's sinful. I understand that many of you grew up in a time when this topic was absolutely taboo, when religious teachings condemned it as a mortal sin. I respect your beliefs. I truly do. But as a doctor, my job is to give you the medical facts. From a purely health perspective, regular sexual activity, including masturbation, is not only safe, but beneficial. It's a form of self-care, a way of taking responsibility for your physical and mental well-being. One of the most significant benefits that often surprises my patients is the impact on sleep. If you're lying awake at night, mind racing, muscles tense, unable to switch off, ask yourself, when was the last time your body felt completely relaxed? After orgasm, your body releases a flood of hormones, particularly prolactin and oxytocin, that naturally promote relaxation and sleepiness. It's like taking a natural sedative, but without any of the side effects or risks of sleeping pills. I had another patient, 68 years old, who'd been struggling with insomnia for years. He'd tried everything: sleeping tablets, meditation apps, warm milk before bed. The lot. Nothing worked. When I suggested that regular sexual activity might help, he looked at me like I'd grown a second head. But he was desperate, so he gave it a crack. Within 2 weeks, he was sleeping through the night for the first time in years. He came back to my clinic absolutely stoked. Couldn't believe something so simple had made such a difference. Your immune system also benefits from regular sexual activity. When you climax, your body increases production of immunoglobulin A, which is an antibody that helps fight off infections. This doesn't mean you'll never get sick, but it does mean your body is better equipped to handle whatever bugs are going around. In the middle of winter, when everyone's coming down with colds and flu, having a robust immune system is worth its weight in gold. Now, let me address a question I get asked by heaps of blokes in my clinic. What if I've already got an enlarged prostate? Is it still safe? Right. If you've been diagnosed with benign prostatic hyperplasia, self-stimulation is generally still perfectly safe and can actually be beneficial. However, if you're experiencing pain during ejaculation, blood in your semen, or severe urinary symptoms, you need to come see your doctor. Those are signs that something else might be going on that needs proper medical attention. For those of you on medications like dutasteride or tamsulosin for prostate issues, these drugs are working to shrink your prostate and improve urine flow. They shouldn't interfere with sexual activity, though some men do experience reduced libido or difficulty ejaculating as side effects. If that's happening to you, don't just suffer in silence. Talk to your doctor about adjusting your medications. Here's something else that's crucial. If you're experiencing erectile dysfunction, don't let that stop you from sexual activity. ED is incredibly common in older men, affects about half of blokes over 60 to some degree. But here's the thing, you don't need a full erection to experience pleasure and orgasm. Many men can still climax with a partial erection, or even without one, and keeping up with regular sexual activity can actually help maintain whatever erectile function you do have, because it keeps blood flowing to the area. If you are struggling with erections and it's bothering you, there are heaps of options available now. Medications like sildenafil, Cialis, vacuum pumps, even injections if needed. Don't be embarrassed to talk to your GP about it. We've seen it all, I promise you. And maintaining your sexual health is worth pursuing, not just for the physical benefits, but for your confidence and quality of life. Right. Let me quickly address the ladies watching this, because I know some of you are thinking, what about us? Everything I've said applies to women as well. Postmenopausal women who maintain regular sexual activity, either with a partner or through self-pleasure, experience better vaginal health, reduced risk of pelvic floor problems, improved mood, better sleep, and even lower risk of cardiovascular disease. The health benefits of sexual activity aren't just for blokes. Let me share another story with you. I had a 74-year-old patient who'd been divorced for about 5 years. He was lonely, missing his wife despite the divorce, and had basically given up on any kind of sexual activity. He came to see me because he was having terrible trouble with his waterworks, getting up 6 times a night to pee, weak stream, the works. His PSA levels were also creeping up, which was worrying. We got him sorted with medication, But I also had a frank conversation with him about maintaining sexual health. He was resistant at first. Felt like he was too old, that it was somehow inappropriate for a man his age. But I explained all the benefits, showed him the research, and encouraged him to give it a go. 6 months later, he came back for a follow-up. His prostate symptoms had improved, yes. But more than that, he was sleeping better. His mood had lifted. He'd started going to the gym again, even joined a lawn bowls club. He told me, "Doc, I feel like I've got my mojo back." That's what I want for all of you watching this. It's not about performance or proving anything to anyone. It's about maintaining your health, your vitality, and your quality of life. You deserve to feel good in your body, to experience pleasure, to sleep well at night, and to keep your mind sharp. Sexual health is part of overall health. It's not a luxury or something frivolous. For those of you who are single or whose partners aren't interested or able to have sex anymore, please don't think that part of your life has to be over. Self-pleasure is a perfectly legitimate and healthy option. There's no shame in it, no matter what you might have been taught decades ago. It's your body, your health, and you have every right to take care of it. Some practical tips before I wrap up. First, make time for it. Don't just wait until you happen to feel the urge. Schedule it into your week like you would exercise or any other health routine. Morning can be a good time for many blokes. Testosterone levels are typically higher then. But evening works too, especially if you struggle with sleep. Create a comfortable, private environment where you won't be interrupted. Lock the door. Put your phone on silent. Take your time. This isn't a race. There's no prize for finishing quickly. The whole point is relaxation and pleasure. If you're experiencing any discomfort or pain, stop and see your doctor. That's not normal and needs to be checked out. Use lubrication if you need it. It makes things more comfortable and reduces friction. You can get perfectly good water-based lubricants from any chemist. Don't be embarrassed to buy them. The pharmacist doesn't care and has sold thousands of tubes to other blokes just like you. If you're on heart medications or have cardiovascular issues, talk to your doctor about whether sexual activity is safe for you. Generally, if you can climb 2 flights of stairs without chest pain or severe breathlessness, sexual activity should be fine. But it's always better to check. Right, let me address a few more common questions I get. What if I don't feel like it anymore, doc? That's common, especially if you haven't been sexually active for a while. Your libido can decrease from lack of use. But here's the thing. Sometimes you need to kickstart the engine. Try it, even when you're not particularly in the mood. You might find that once you get started, your body responds. Think of it like exercise. You don't always feel like going for a walk, but you usually feel better after you do it. Is there such a thing as too much? Well, if you're doing it multiple times a day, every day, to the point where it's interfering with your daily life, your relationships, or causing physical discomfort, then yes, that might be excessive. But 2 to 3 times a week? That's perfectly healthy and normal. Some blokes are comfortable with daily, others prefer a couple times a week. Find what works for you. What about porn? Look, I'm not here to make moral judgments. From a medical perspective, if you find visual stimulation helpful and it's legal content between consenting adults, that's your choice. However, if you find yourself needing increasingly extreme content to feel aroused, or if it's affecting your ability to connect with real partners, that might be something to discuss with a counselor. The bottom line is this: your sexual health matters at every age. You're not too old. It's not inappropriate. And it's definitely not something to be ashamed of. Regular sexual activity, whether with a partner or through self-stimulation, provides genuine, measurable health benefits for your brain, your heart, your prostate, your immune system, your sleep, and your mental well-being. I've been treating older men for over 20 years, and I can tell you with absolute certainty that the blokes who maintain healthy sexual lives, however that looks for them, are generally happier, healthier, and more engaged with life. They have better relationships with their partners. If they have them, they sleep better, they're more confident, and they just seem to have more energy and enthusiasm for life. So here's my prescription for you today. Make sexual health a priority, whether that means scheduling some alone time a couple times a week, having a conversation with your partner about revitalizing your sex life, or seeing your doctor about erectile dysfunction or other concerns. Take action. Your body and mind will thank you. If you found this video helpful, do me a favor and hit that subscribe button. I put out videos every week on health topics that matter to older adults, and I'd love to have you along for the ride. Drop a comment below and let me know your thoughts, any questions you have, or topics you'd like me to cover in future videos. And if you think this information could help a mate, share it with them. We need to break down the stigma and start having honest conversations about these issues. Remember, aging doesn't mean giving up on pleasure, vitality, or taking care of yourself. You've earned the right to enjoy your body and feel good. Don't let outdated taboos or embarrassment prevent you from living your best life. Take care of your sexual health, and you'll be taking care of your overall health. Cheers, folks, and I'll see you in the next video.